that is a sternum, that is an osteological chapter. Today we are going to look about the sternum. What is sternum? Sternum is a part of the rib cage which protects the body. Now there are many vital organs inside the rib cage. So let us introduce the sternum. Sternum is a flat bone. It resembles like a sword shape. It divides into three parts, that is manubrium, body and sternum, and Xiphoid process. See, as you can see in the diagram, there's three parts. The top portion is called manubrium, the medial portion is the body, and there's Xiphoid. There are many articular facets and there are many notches which are present in the body. We'll see in this today's classes. You can see the shape of the sternum. It looks like really like a sword. Now we'll see how it looks like a sword. So let us start with the chapter. So see, the upper part resembles like a handle of a sword, middle part resembles a blade, and the lower part forms the point of the sword. I hope you have seen the sword. That is what it resembles like a sternum. It is not completely straight. It is from anterior portion, it is convex, and from the posterior side, it is concave. And the length of the sternum is around 70 cm for an adult. It is longer in male than female. It's a very important point. Note this point. So now let us see. There's one diagram in front of me. I will show you. So this is the diagram where we can see the sternum holds the ribs. The ribs are not directly attached to the sternum. It is attached with the costal cartilage. What is costal cartilage? Cartilage is a soft part through which provide the ribs for flexibility. Now people may ask why we need flexible. That is for the vital organs like lungs. Now see, as you can see, the first part is called manubrium, second is the body, and the last part is Xiphoid process. So all the 7 parts of the ribs are directly connected to the sternum. I will teach you that in the next class or in the next one. Now come, let us start with the manubrium. Manubrium is the first part of the body. As you can see, there's the top part, the suprasternal notch. What is supra? Supra is the superior, sternum is sternum. And the right and left, there's a clavicular notch. What is clavicular notch? Clavicular notch is the portion where clavicle is attached to the manubrium. And there's one more notch called first costal notch, through which the first rib is attached. Remember, in the manubrium, there's only first rib that is attached, not first rib, that is the costal cartilage of the first rib. And there's a transverse section, that is sternal angle. I will teach you in the further slides. Now comes a lot of features of manubrium. Okay, as you can see, the first one is, what is the first one? That is called sternoclavicular joint. With the second one, it marks the suprasternal notch. The third one is the first costal notch. And the strongest part of the sternum is the manubrium, and it is in quadrilateral shape. What is quadrilateral? Quadrilateral means it has around 4 sides. As you can see in the diagram, it has 4 sides. Now what is the manubrium? Manubrium is the first part, is very hard and very strong. Now look at the second part of the sternum. That is the body of the sternum. So let's present. Now the body of sternum, as you can see, it around 6 costal cartilage. The second costal cartilage, third costal cartilage, fourth costal, fifth, sixth, and seventh. Now remember, the second costal is not fully attached. It is like demifacet. What is demifacet? The lower portion of the ribs are attached to the second is the body, and then second and seventh are called as demifacet. Means only half portion is attached to the body, and the rest 3 to 6 are attached directly to the body. This is the main important point you're going to see, as you can see in the second diagram. Now let us see the features of the body. Anterior surface is flat, directed forward and slightly upward. As you can see in the second diagram, as it is directly clearly say that it is facing forward and it is a little upward. And posterior surface is convex. See the convexity. It is concave from the posterior and the front side is convex. Upper end joint lower half with the second costal cartilage and lower end joint with the upper half with the seventh costal cartilage. That is called as demifacet. Demifacet I will teach you in the next class. Now let us see with the diagram of the lower part. See the lateral body of sternum have articulation. There are 2 articulations, that is from the second rib and the seventh rib. There is the lower of the second costal cartilage and the upper of the seventh costal cartilage, which is not attached directly. It is like half part is only attached to the body. And third to sixth costal cartilage, the full costal cartilage attached to the body. So remember this, there is second to seventh, and second and seventh only half parts connect to the body of the sternum. Now let us see the sternum, that is Xiphoid process. This is Xiphoid process, as you can see in the diagram. Xiphoid process is the smallest part of the sternum, which is shaped is around bifid or perforated. Upper end becomes ossified in adult before it was cartilaginous. This is a very important point. Before when we were small, it will be a cartilaginous like body and manubrium. But now as we grow as an adult, it is get ossified, it becomes very strong. But it is called the smallest part of the sternum. As you can see in the diagram, it clearly marks the smallest and the lowest part. The lower part, the third part, is a Xiphoid. It's also called a Xiphoid sternum. Let's remember this point. Now see, there is one very important point, the sternal angle. Sternal angle presents between the manubrium and body of the sternum. It is weakest area of limb and common site of the fracture. Very important, and very important as many structure rises to sternal angle that I will teach you in the further classes, and also called as the angle of fluid. Sternal angle also called angle of fluid. This is the angle formed between the body and the manubrium. Very important, and it's very many vital organs pass through this. I will teach you in the next class. So I hope you understood the classes. Thank you for watching this video. I hope you understand. If you have any doubt, you can contact or DM us in the Insta. I hope you will do so. Thank you for watching this video, and please keep supporting. I hope you like this video. Thank you.